My name is Dr. Samuel Nyagah. I'm an ENT surgeon, specialist at Nairobi ENT Clinic. My areas of specialty or of interest is allergy and also rhinology. Rhinology referring to conditions or diseases that affect the nose and the sinuses. An allergy is a disease condition that is caused via an interaction between the body and a substance that is usually not harmful to other people. And there are many allergic diseases or there are many allergic conditions, and the common allergic conditions include allergic rhinitis or what we call hay fever. The second most common allergic condition is asthma. Then also we have other allergic conditions like eczema, that is allergy affecting the skin. We also have allergy affecting the eyes, what we call allergic conjunctivitis. Then also we have food allergies that we know that there are some people who react on eating some foods that millions of us keep on eating without any problems. Testing for allergy, basically there are two types of tests that we do to confirm that somebody has got an allergy and also to identify what this person is allergic to. Now, there are tests that we can do in the lab, and also there are tests that we do in the clinic or the tests that we do on the patient's body. And all these tests have been done for many years and they've been shown to be very effective. Now, when we talk about allergic testing, I think what comes to the fore or what we mean is that those tests that we do on the patient, and they are called the skin prick tests. Now, the skin prick tests, it involves introducing a very small amount of that substance that we suspect that somebody is allergic to and making a very small prick with a specialized instrument and seeing the reaction that will develop on the skin of the patient in 15 to 20 minutes time. These tests, you can test very many substances at the same time. We do them on the forearm of the patient. Sometimes if you're testing for very many substances, you can do them on the back of the patient. The skin prick test, we do them in all patients from children as young as 2 years to whichever age the patient is. And once we do them, and by introducing the various substances on the patient, we are able to see the reactions, and then we are able to make some conclusions as to what the patient is allergic to. Compared to the lab tests, studies have shown that the skin prick tests are very sensitive in as far as making the diagnosis is concerned, and they are rapid, they are cheap compared to the blood tests, and in fact, they might be more relevant to the patient or to the doctor than doing the lab test, because you'll be able to see the reaction of that substance with the patient on the patient's body, and it's of more value. In fact, most studies have shown the skin prick tests, they're of more value to everybody than doing the blood tests. They're not painful. Somebody might fear probably when you hear the prick, but they're not painful, and even children are able to tolerate them. Well, are there any special preparation for somebody before they do the skin prick tests or the allergy testing? The answer is yes and no. The yes is because there are some medicines that we know that interact with the outcome of the tests. And therefore, one, if the patient is taking certain medicines, especially the antihistamines, then we shall ask them to stop taking those medicines at least 1 week before they come for the tests. And there are many other medications, but they are not commonly used, so I'll not talk about them. But the commonest one are the antihistamines that the patient should avoid. Now, there are certain times then we fail to do the tests. For example, if you get a patient who is asthmatic and the asthma is not well controlled, then you would wish that they first get the asthma well controlled before they come for the tests. Allergy testing is very sensitive, and I'll explain this in two ways. If we did an allergy testing and we find that somebody is not allergic to house dust, or the reaction to house dust mite is negative, then we can absolutely say that that individual does not have any allergy to house dust mite, regardless of what they think or what they've been told before. However, a positive test does not necessarily mean that you have allergy to that substance that has been tested. For us to say that somebody is positive or somebody has allergy to certain substance is not just an issue of looking at the allergy skin testing, whether they are positive or not. Once you get a positive test, then you have to relate that with the history of exposure of the patient to that substance. For example, if I did a test and I find that the patient has allergy to cats, and then from their history, they tell me that once they go to their neighbor or to their relative who has got a cat, they get these kind of symptoms, then we can conclude that the cat is a cause of this. There has to be a correlation between the history of exposure and the results of that test. Same thing, probably I'll drift to food allergies. If you did a test, like for food allergies, and you find somebody has got allergy to fish, and they tell you, I've been eating fish from the day I was born and I don't get any problems with that, then since there's no correlation between the eating of the fish and this test that is showing that this person is allergic to that fish, then we can say that that is not a true allergy, because we are not treating the tests, we are treating the patient in this case. But once a test is negative, then it is negative, and it tells us that there's no way that this person can be allergic to that which we found to be negative.